Welcome to the One Day at a Time Recovery Podcast, where my guests share their stories of addiction, how they recovered, and the tools and practices they use to stay sober now. Well, Dr. Rymock, thank you so much for being with me today.
Yeah, thanks for having me.
We're going to be talking about some ketamine, which I'm really excited about. There has been some um, stories in the news about, Matthew Perry was kind of abusing it, but I thought it would be so helpful to have you come on and sort of clarify sort of like the proper uses, where it's contraindicated, the appropriate ways to administer. I think there's a few ways it can be administered. I want to talk about like what are good use cases. People that are listening to this podcast typically are dealing with things like treatment-resistant depression. Maybe they've been on SSRIs for a long time. They still feel depressed, which I hear is a very common experience. So I'm hoping to sort of bring some clarity and some solutions for people who are thinking about introducing alternative ways to deal with things like depression and anxiety. But maybe first, before we jump in, you could tell me a little bit about who you are and what you do.
Sure. Yeah, I'm Mark Rymock. Please feel free to call me Mark. But I am a psychiatrist. I did psychiatry residency, finished in 2006, and I did addiction psychiatry subspecialty training, finished that in 2007. Went on to start a private practice, which then became a group, and we started taking on other psychiatrists. Now, over the years, we've grown to include 11 psychiatrists and 4 therapists and a ketamine therapy program, which has now been in existence for 5 years. It's definitely been a labor of love, a different type of practice of medicine for me because I was always used to talking to people individually, face to face, and this is more of like a clinic model with a lot of, moving parts. But, we have really proud of what we created there. And, we have a great administrative staff that explains the process to patients, and then a great nursing team, and then docs and nurse practitioners that work with the patients too. So that's been my latest focus, but I definitely still do a lot of addiction work, helping people with general psychiatric issues, but also addiction issues, detox on an outpatient basis, anti-craving medications like Vivitrol and Suboxone as well. So that's most of what I do day to day.
Yeah, no, that's gosh, that's such important work. I feel like there are a lot of doctors who actually are not well versed on addiction. I hear stories of people going to like their general practitioner and maybe not getting the best advice. And I think it's so important for people with addictions to seek out professionals who have specialized training in addiction. So I really appreciate your focus on that. What led you to focus on addiction recovery?
I grew up like many people with some addiction in the family, and not in my direct household, but extended family, uncles, aunts, other family members that had issues, and found myself just kind of interested in the way that people work and the decisions they make, and noticed that sometimes there are these substances that hijack the healthy intention of a lot of people that I've known. And when I went to college, I took on a part-time job that turned out to be a research assistant job at a world-renowned drug treatment research center. So from my youngest academic years, college and beyond, I really saw addiction as just another condition that there is treatment for, and therapy and talking is part of it. But then there are also medicines that can help. And I knew I wanted to go to medical school and be a psychiatrist. So, that's the path that led me to where I am today.
Very good. I find it so interesting. We haven't had a whole lot of innovation since SSRIs like Prozac and things like that was like 30 years ago. And in the parlance of like 12 step, there was a lot of judgment around people that are consuming medications that are psychoactive. Is that the right term? Psychoactive medications?
Sure, yeah, psychoactive, psychotropic, yeah.
Psychotropic, yeah. And I feel like we've come a long way in terms of like community acceptance. And now there's this new wave of psychedelics that are really revolutionizing the way we are treating things like addiction. I've spoken to a lot of experts who are using like psychedelic assisted therapies. Does ketamine qualify under the umbrella of psychedelic assisted therapy?
Yeah, ketamine is considered a psychedelic medicine. It's different from classic psychedelics like LSD and psilocybin and mescaline. In that it also has a dissociative component too. So I think of it as straddling the line between a psychedelic and a dissociative. And so dissociative meaning that a person does feel kind of disconnected from their body. They feel like almost as if they're dreaming. They're not, they can even forget like where they are when they're getting a treatment. They'll forget they're in a doctor's office, etc. So yeah, I think that's accurate. And there is possible, one of the things we do in our office is offer, psychotherapy during the treatment because yes, there is this new chapter of psychiatry opening up where almost every psychedelic is being studied for almost every
Yeah.
psychiatric indication. A lot of that is in research, so not ready for prime time. It's not something that I, have any license or interest in recommending at this point because it is not legal for medical use, not in California anyway.
Right.
But ketamine is. Ketamine's been around since 1970, so it is FDA approved for pain and other things. We can use it to treat mental health issues when evidence supports its use, and there definitely is a lot of evidence supporting its use, specifically for treatment-resistant depression, as you brought
Mm.
up, and also growing evidence for help with anxiety and PTSD, trauma, things like that.
Yeah, complex PTSD. And I've seen some pretty interesting case studies on those. So let's sort of back up a little bit because what most people are familiar with are like antidepressant medications like SSRIs.
Mhm.
Why is it that why is it that people take SSRIs and still feel depressed?
Yeah, SSRIs, like many other and other antidepressants that are available, and including ketamine and other more potent treatments, aren't perfect. There is no such thing as a magic bullet. There is no medication where 100% of people respond and zero people get side effects. So, with any medicine, when we choose a medicine, we do so because we think that there's more upside than downside, but there always can be a balance, and that's what a doctor does in weighing a potential treatment for a person is trying to make sure that the benefits outweigh the risks or any side effects they might be getting. Yeah, the stats with SSRIs are something like two-thirds of people do get better, but one-third don't. And that's a significant percentage, especially if you think of depression as one of the most common conditions that people have, that are a lot of people who've tried traditional SSRIs and haven't done well with them. And even of the people that respond to them, some of them have side effects. The nagging side effect for many people is like some sense of numbness, like either emotional
Yeah.
numbness or libido being decreased as well. And so, that's the other part of things that might not make an SSRI a sustainable choice for a person. Maybe it can work in a crisis moment, but eventually when crisis passes, people say, okay, I don't want to be on this for the rest of my life.
Yeah, that's fair. Um, s- is it fair to say that if somebody is choosing SSRIs, it should be in conjunction with some sort of psychotherapy like CBT, IFS, some things like that?
Should is a good term. It, yeah, represents an idealistic approach.
Should. Should we shouldn't
Not
should all
everyone's
over
interested
everyone.
in that too, or has time to do that. But
But
yeah,
ideally,
ideally, yeah. And the
yeah.
saying is medicines work, therapy works, but the combination of the two yields the most potent result. And so,
Yeah.
definitely for more severe cases, then that becomes more of a mandate than a should.
Yeah, I like to think of it as soap and water together or better.
There you
Get clean. A little recovery humor. Um, okay, so the people that are not responding well to the SSRIs, are these people that are good candidates for ketamine assisted therapies?
go. They definitely can be. The rigid criteria to see if someone has a treatment resistant mood issue is trying and failing two different
Oh,
conventional medications. So once a person has tried two different antidepressants, and many of the people that I see have tried 15 or 20 or more, so
yeah, yeah.
um, then they become candidates for a treatment-resistant procedure that can treat people. So they could include ketamine or TMS, transcranial magnetic
Oh, yeah.
stimulation, or ECT, electroconvulsive therapy, or shock therapy is still done pretty rarely, but is still an option for people with severe cases that haven't responded to anything else.
Is the ECT typically done for people that have other severe, like what do they call it, comorbidity issues or coexisting issues
Yeah,
like bipolar?
sure. Yeah, ECT is done for various types of severe mental illness, besides even depression, bipolar disorder. It can be used in mania associated with
Mhm.
bipolar, not just depression associated with bipolar. It can also be used for schizophrenia or schizoaffective disorder as well. So, yeah, that it's oftentimes considered a last resort, and proponents would say people often wait too long because it actually is very effective and very safe. But yeah, a person can't really work during the month that they're getting ECT. It's usually three treatments a week for 4 weeks. So
Oh, wow,
it
that's
is
pretty
a
intense.
big commitment. Yeah,
Yeah. I think it has sort of like a bad rap from like the days of One Flew Over the Cuckoo's Nest.
totally. Yeah, yeah. It's got a negative PR image for sure.
Yeah, we need to do a little PR around that.
But
Um,
yeah, the treatments then that I'll often discuss with patients, like once they're kind of done with the conventional medications and ready for a treatment that's more of like a procedure as opposed to yet another pill, would be ketamine or TMS, transcranial magnetic stimulation. So yeah, TMS uses a magnetic field to stimulate parts of the brain. It is a fairly intensive in terms of the schedule also, but doesn't have the side effects that ECT does. That's like 5 treatments a week for 6 or 7 weeks, an hour a treatment, but a person can still, go to work after or school or whatever. Whereas ketamine is 6 treatments within a 2 or 3 week period. So there is less intense of a schedule associated with getting ketamine treatment. Um, but a person does need to kind of clear the rest of the day. You can't just go to work after a ketamine treatment. And why would you want to? Is kind of another question.
Well,
The, the,
we'll get into like how it affects people, like what happens during a session. I think people will be really
yeah,
curious about,
yeah.
and I'm always looking at through everything through this lens of overcoming addiction. And the reason why we're sort of focusing on things like depression is that a lot of people with addiction issues are suffering with depression,
Mhm.
right? Even in like long-term sobriety. I'm somebody in long-term sobriety, and I don't typically, that's not my thing, but I just have seen that a lot where people have done all the steps, they've done all the therapies, they've tried a bunch of different medications, and there's still this undercurrent of depression. And so what is it about ketamine? You mentioned a dissociative um, aspect to the experience. So, what is happening during the ketamine experience that they are, what is important about the dissociation part that helps people sort of like heal this root cause issue that's causing the depression?
Yeah, ketamine works on both a chemical level, like as a medication, and also there is an experience around it. So, chemically, it's got certain it blocks glutamate, a neurotransmitter in your brain associated with stress. But as far as like the actual experience of it, yeah, a person feels kind of warmer, lighter, and even, increasingly kind of disconnected from their physical self during the course of a session. I conceptualize that as a person getting almost like a therapeutic distance from themselves and their usual thought patterns. And they describe often being able to feel like they see the big picture in those moments, and maybe even thoughts, feelings, emotions that may be hard to face in their regular day-to-day life become more finite. They can kind of step back and not see it as
Accessible.
something that's, yeah, consuming them or paralyzing them. And they can even start to work with certain painful concepts. Maybe some aspect of its anesthetic use is that a person is kind of like a little protected from the pain that usually sparks that reflexive, defensive, like push away and don't think about that thing. But then that allows that thing to kind of keep on perpetuating and having power in their lives, and so the goal here is to help people move past those things that maybe have kept them stuck in where they are in their lives.
So, would it be fair to say that during a ketamine experience, if they're sort of dissociating from, is it like they become more objective about, like they're able to reflect on past experiences? Let's say they have, a sexual abuse, physical violence, these types of really traumatic events. Are they then able to sort of re-experience those events in a objective, detached ways so it doesn't like overwhelm or consume or shut them down so that they're able to sort of reprocess those experiences?
Yeah, that's exactly right. That's definitely how I conceptualize it. Therapists that do ketamine-assisted psychotherapy conceptualize it too, is that people are able to see those events almost as if they happen to someone else
Mhm.
because they feel that distance from themselves in those moments. But then they also process the fact, okay, well, in the same way that it happened to that person and that person is able to move on, when they kind of go back into their bodies, the goal is to be that person then is then able to move on. So it kind of helps them even conceptualize like a hope, where that people do move on from this, and then when they become
Yeah.
go back into themselves, then they are able to kind of live that recovery and move beyond it.
Yeah, what is it about so my understanding is that you kind of have to feel it to heal it, right? This sort of like
Right.
idea that we experience traumatic, difficult, painful things, and then we just kind of shut down around it. It's like we bury it in some sort of, but I liken it to you put it in a barrel, but it becomes like toxic waste that leaches and it affects all your other, and I know addiction is mostly about distraction from pain that we don't have the skills or the support or the ability to process to resolution. So it kind of seems counterintuitive that by detaching, that are you still able to connect with the sadness or the pain that's underlying? Like it seems opposite. Do you know what I'm trying to say?
Yeah, yeah. There are degrees of detachment and dissociation. And so the goal and the right dose, that's also part of the process, is finding the right dose for the therapy where a person still has enough connection that they can still feel feelings and
Yeah,
remember how they felt and 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 be a part of themselves too, but also have more of that like kind of therapeutic distance so that they can face things that they've not been able to face in their ordinary lives or even in ordinary therapy. So one of the
right.
indications for CAP therapy is when a person kind of has plateaued and reached the point of stagnation in regular therapy. Sometimes adding ketamine to the treatment can help a person kind of get like a second wind, basically, in terms of processing things on their own.
Yeah, because I think, like, so for someone like me that's been in long-term sobriety, I feel like I've done all the therapies, right?
Hmm.
And I had some childhood experiences that were really difficult. And I was feeling like, oh, there's just so far that, like, it's almost like if you talk about it too much, you become sort of numb to it. You can't really access, like,
Right.
but it's still sort of, things that happen in childhood, instill these ideas of not good enough, not smart enough. Do you know what I'm saying? Like these
Hmm.
these negative self images, and talking about it, talking about it, and talking about it, and trying to, you almost become numb to it, like it's
Yeah,
hard
it
to
becomes
reach
just
those
another
deep.
rehearsed behavior that you've dissociated, maybe even as a defense against that. It's just, yeah,
Yeah.
you then have this soliloquy that you might give like every time you meet a new therapist, let's say.
Yeah. I usually spend a lot of time educating therapists on addiction, but that's a whole nother story.
Right.
But yeah, so it seems really interesting for especially people in long-term sobriety that this might be a tool to sort of get to those deeper levels, and so that it's not necessarily, I hate to use the word performative, but or rehearse, but to get to like these really raw, authentic feelings, processing them, feeling it so you can heal it, kind of a thing.
Exactly. Yeah. Yeah, it's well known that many people turn to alcohol and drugs as a form of self-medication. And so
Right,
when they go through the recovery process and recognize that, that didn't work for them, they may still have the original depression, PTSD,
right.
anxiety that led
Yeah,
them or exacerbated their drug and alcohol use. And so that's where ketamine as a treatment for the mood issue, that I would not say it's specifically a treatment for addiction, but for comorbid
right.
depression, et cetera, that
Yeah,
may have led to addiction. And so that's why, yeah, the ideal is to have, in terms of like candidates for ketamine treatments, are people who do have solid long-term recovery. One concept I have is I never want even the perception that ketamine is involved in a person's cycle of abuse. It is a medication, it is a controlled medication. Certain people, abuse it recreationally, but this is a medical treatment for a real medical condition in terms of depression or other qualifying mood issues. And so, we definitely need to be clear on what we're treating with it and making sure that we're do no harm is one of the first sayings in medicine too. So we don't
of
want to,
course.
yeah, rekindle any addiction issues or cause any issues like that.
So, do you have recommendations for how long somebody should sort of have been in recovery before? I realize it's sort of a case by case basis because I see addiction as a spectrum. There are people who can kind of take it or leave it, and then it starts being problematic to people who are really severely addicted. Let's just say somebody that's sort of like mid spectrum where they had a problem, they got sober to whatever degree that means. I know there's a lot of controversy around like California sober and things like that, but let's just say they're sober and they've had like a year, maybe they've done some therapy, maybe they've worked some steps or participated in some sort of program. Like, what would be, and they're still feeling that treatment resistant depression. Like, when would you say would be a good time to
Yeah,
start
I mean, the
investigating?
ideal would be a year or more. At a year, you've basically been sober long enough to rule out even post-acute withdrawal as being any contribution to that person's depression. But like you said, it is case by case. And if
Yeah.
there's a clear history of depression, even that preceded addiction issues, or maybe they've had other periods of sobriety in their life where they can still identify, like, yes, and I was really depressed during those times, then, that could also make make a case for treatment a little bit earlier.
Yeah. Yeah. I mean, I know I understand that depression is really hard to live with. And so people are really seeking relief. And so maybe you could let's give people some hope because I feel like people really relate to stories. Like, can you share some stories? Obviously, respecting all HIPAA and
Sure.
all that, but what kind of stories can you share to give people some hope?
Yeah, I mean, definitely. In our practice, we see all kinds of people, with all sorts of stories and issues in the past. Some simple, but many complex too. And I mean, so I've definitely seen people who've tried, like I said, 15 or 20 conventional antidepressants and, not really responded well to any of them. They may have tried things like TMS. And then, in certain cases, ketamine treatment is something that they approach with some skepticism. Maybe their sense of hope has already been burnt out by a lot of treatment failures before. And yeah, I'm thinking of, one specific patient, professional female who's in her late 40s who, really, responded very well to it, like from the beginning. And she happened to have been in long-term recovery, something like 15 years of recovery, and was sort of skeptical about it, because there definitely is a stigma against, controlled medications being used, like, quote, unnecessarily. So, we definitely needed to
Right.
have a lot of talks about, like, it actually is okay because you're being honest with me and I'm, making a good faith effort to really, determine all treatment options. We looked at what you've tried and all. And I mean, she actually really responded beautifully from the beginning. The very first session, she had a lot of epiphanies and kind of realizations about people in her life and things that have happened to her, was able to put therapeutic boundaries on letting in certain people that she felt obligated to, have a certain degree of emotional closeness to her, and able to keep them at arm's length to protect herself. And
Somebody, was this in regards to like unhealthy family members?
yes, exactly. Yeah.
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 Yeah, yeah,
Lot,
those are
lot
the
of,
people who feel like they're obligated to have your time and they're not.
yeah, especially like, yeah, during the holidays and all, like the people that you
Yeah.
might see only Thanksgiving and Christmas, but there's kind of a reason for that, right? And so, she really,
Yeah. These
cemented
people.
to her that concept of like the difference between your family of origin and your family of choosing, and she can choose
Yeah.
to have people that are going to be supportive to her, build her up, as opposed to, keep her mired in any negative thought patterns, or even, self opinion, self-esteem, view of self. So
What was the epiphany like? Was it like, oh, these people don't deserve? Was it like, oh, these people are unhealthy and I don't deserve
yeah,
to
like
be
what
treated this way?
her specifically was on what is love, and
Ooh,
love, she came to the conclusion that love is an act that is carried forward, and person who loves someone will care about the way that they feel.
yeah.
If there is a sense that certain bridges haven't been mended, they will care about that. They will ask questions about it. They will make sure that everything is, they're still doing right by them. But if people are just interested in more sweeping things under the rug, that's not a sign of support. That's not a sign of love. And she realized that even though she may have had members in her family who said, "I love you," it's not, it didn't meet the cut. Definitely not the way that she needed to be loved, because now she like had this, um, realized what she was worth in terms of, and the way that she needed to be treated.
Man, that I think you just hit the nail on the head there. I think that a lot of times people just have a warped sense of their own personal value,
Hmm.
especially if, people who've walked through addiction, being in addiction, we tend to do things that we don't feel good about. We treat people badly. We might, be dishonest or steal or make bad decisions that affect others. So there, it's not like there isn't a reason not to feel bad about who we were during our addiction, but in recovery, it's a process of sort of making peace with who we were while we were under the influence, and who we are in sobriety, and feeling like, have you seen like a lot of self-forgiveness, a lot of developing a sense of self-worth, that we are worthy of receiving love, those kinds of things?
Sure, yeah. One of the big concepts we talk about is, yeah, be kind to yourself, be gentle with yourself, be generous in terms of giving yourself time to grieve or even time away from people if you feel, conflicting feelings about them, to kind of take your space and the right to do that.
Mm, that is so important. And I wonder about, long held patterns, coping strategies for stress. Like there's, particularly in my world, I deal a lot with, like, I feel like I'm a high functioning, like a sort of an overachiever, but leaning on the workaholic side where it becomes almost self-abusive, but it's sort of oriented in this childhood of experience of performing for validation and love and acceptance,
Mhm.
like achieving for. Do you see changes in people who are able to sort of break these long-held, maybe they're self-sabotaging behaviors, these behaviors that, may be rooted in like self-help or self-improvement, that just go too far and become another form of, do you know what I'm saying? Like
Yeah,
self-abuse.
yeah, we try to be aware of when even like a healthy, quote, healthy behavior like work or exercise or dieting might go past like a healthy point and become compulsive, and
Compulsive.
to what
Yeah.
extent is, a behavior, even like I said, a healthy one, actually healthy to that extent, all things in moderation probably applies here too. And there is such a thing as, like, yeah, too much work. And if a person is doing it because they feel some deficit inside and they're trying to kind of fill that hole, I mean, that's probably actually not going to work. It'll be some, type of distraction, like you said, but it won't necessarily make them feel at peace at the end of the day. They'll always be thinking about like that next thing. And so, yeah, the goal is to kind of stop, pause, and, assess that self-love and allow for ambition, because, yeah, the goal is not just to have people then be self-satisfied and not have any goals or
Yeah.
do
We
anything,
don't want to be
there
zenned
needs
out on the couch doing nothing. That's not the goal.
Yeah, yeah. So there needs to be a balance there. So where a person both feels okay with who they are and may have a vision of becoming or doing something more, but being okay with where they are and the whole journey from A to B, so that, there is no point at which they feel that deficit or things are being motivated by, like, yeah, low self-esteem or self-hatred or anything like that.
So then, as somebody develops this sense of self-love and self-esteem, their motivations aren't sort of from that dirty fuel source of like fear or trying to prove themselves. It becomes from a place of creativity and
Yeah.
joy and things like that.
Yeah, dirty fuel is a good term. I like that. Yeah.
Yeah, yeah. I didn't make it up, but it seemed, it's like there's these fear-driven states that really compel people to like get ahead and be high achievers and all that stuff. But I find that, it leads to places like burnout, and like if you reach your goal and you don't feel any different, like that is super depressing.
Right.
That's like those
Mhm.
people who, I just heard this story about the guy who developed Minecraft. He was a coder. It was a hugely popular game. He sold it for like a couple $1 billion. I think he netted like $1 billion, and then lives in LA and outbid Beyonce and Jay-Z for this mansion. And he's miserable because he lost all purpose and he's isolated. And so it's like you can work really hard and achieve your everything that you think that you want, only to find that that wasn't really the end goal to begin with, right?
Right.
So yeah, anyway, that was sort of a tangent. I am so curious about the actual process. Once someone comes to see you, they have like this treatment-resistant depression, you've decided on ketamine therapy. Is the How do you administer? I hear that there's like an IV administration or maybe some other ways. How is it administered and what is the actual, it sounds like it might be an hour or so. Can you kind of walk me through what the experience would be like?
Sure, yeah. The gold standard, we would say, the route that is proven by a lot of research to be effective is IV infusion, so a slow, steady IV drip over the course of 40 minutes. The actual treatment, the infusion runs for 40 minutes, and then a person has something like an hour to kind of slowly come out from the effects of the
Afterwards.
medication. So there are other ways to administer ketamine too. You know, with an IV, 99% of it gets into the bloodstream and that goes right to the brain. So that one of the reasons it's studied is because it is able to be replicated in research studies and it allows for very precise dosing. So, you know, one of the artifacts of research is that the way it's studied ends up being the way that it's recommended. But that's mainly because it was studied in that way. For people that IV is not an option, if they don't, they can't, you know, tolerate like an IV sitting in their arm because of some pain issues, or maybe they have bad veins, then there is an option for intramuscular injection, so an IM injection of ketamine, where 93 to 96% of it gets into the system. So it's still most of it gets into the system. Um, Gives a similar experience, although it's slower to onset, but then does peak higher and then kind of drops off a bit faster. So it is like a kind of shorter, more intense administration. For that reason, sometimes we'll separate injections, so like half the dose at once, and then the other half 15 minutes later, and that makes for like a kind of more gradual onset. So that's the other IM route. Um, there is an FDA approved form of ketamine called Spravato. So that is the, when I say purified, if you think of gloves, there's right and left-handed gloves. If someone makes ketamine in a lab, there's right and left-handed versions of the molecule. So Spravato is just the right-handed version. So basically this um, chemical purification allowed for Janssen, the company that makes it, to get a patent on it because you can't patent generic ketamine. It's been around since 1970. It's been generic for a very long time, but they got a patent on it in 2019 for treatment-resistant depression, and they also now added on for have another FDA indication for acute suicidality. So people who are having
Mm.
suicidal thoughts or behaviors because ketamine works very quickly. So that's also kind of one of the benefits of ketamine. Instead of taking
Okay.
4 to 6 weeks to kick in fully, is that very often works after just one session. Sometimes it takes a few, but so yeah, that's Spravato. And then there are like compounding pharmacies that'll take generic ketamine and make like lozenges. So that's one option is you know, can take a lozenge that absorbs under the tongue through the mouth. Spravato, the absorption is something like 45%. The lozenges are something like 30 to 40%. So those are all sort of like less potent than the IV method, which gives you, like I said, kind of the best control. You know, you can also pause the infusion, which certain people appreciate that security. Although realistically, people do tolerate it so well, like almost no one ever asks to stop or pause the infusion. They do tolerate it okay.
And so what is happening during the, let's say, peak period? It sounds like there is somebody with them, and are they asking questions? Is it like a therapy
Yeah.
session?
So in our office, we give people the options of psychotherapy, talk therapy during the treatment or not. Because all the research that's done with ketamine is actually has only looked at it being used as a medication alone, not coupled with therapy. So that definitely can work and does work for the majority of people that get ketamine treatment. We always have a person with them. Usually it's a nurse that's administering the treatment. But if a person chooses to have a therapist, we'll have the therapist sitting with the patient, and then the nurse is monitoring their vital signs from another room. So they're still being medically monitored from another room, but the therapist is engaging with the patient during their session. So um, yeah, during ketamine-assisted psychotherapy, like yeah, it's just like regular therapy, except there is an experience around it, right? So, the treatment even starts before the medication session. There are an evaluation where, the therapist gets to evaluate the patient slash client, and they also evaluate the therapist too, and they build some rapport. So we always recommend a few sort of even introductory slash preparation sessions to also prepare for the actual medication experience. And set an intention, like what do you want to work on during your treatment, and what will that look like, and then during the actual treatment, therapist sits with them, the IV starts, and they just kind of go through that journey together, starting from the beginnings, like just kind of feeling sort of warm and light and dissociated, and then, where their mind goes, therapists will often kind of encourage them to follow the experience wherever the journey will take them. So if you see a door, open it, if you see a button, push it, just kind of like lean into the experience. Because also one of the things that people are prepared with is it is a round trip ticket. Wherever you go, you will come back. You are in a safe place. Your safe physical self is being monitored by a nurse. Your psychological self is, being monitored by me, the therapist, who's with the person. And then, they have the room to go wherever they want, going over things that have been tough in their lives, but maybe also talking about the great things in their lives and how they want more of that, and how they want to, I think one of the things that probably keeps people out of therapy is, feeling they're just going to be mired in their depressive topics
Yeah.
and they kind of want to avoid them. But, the
Yeah.
goal is to kind of get people to embrace lives, embrace themselves, to live fully, etc. And then when the infusion stops, the medication starts wearing off, the person is kind of regrounds within themselves, and kind of comes back. And then at the end of the session, they'll feel a lot of times a little wobbly, but not sedated. We definitely um, don't allow driving after the treatment. They need to be picked up, ideally by someone they know, as opposed to
No
Uber.
Uber?
Uber. Oh, if transportation is an issue, I mean, Uber or taxi is okay, but we do
Yeah.
make sure that they're safe to leave.
Yeah.
Um, and then, yeah, when we get home, when they get home, we encourage, quiet reflection,
Mm.
meditation, walks in nature, art, journaling, music, activities that will kind of be promoting their relationships to themselves and their vision of where they fit in the world, and hopefully acquiring a little more of a sense of their purpose in life, and where they want to go.
Yeah, that is so important, like reestablishing purpose and getting clear about what it is that we really want outside of maybe society telling us what we should be doing or family telling us what we should be doing, like getting a clearer sense of what is it that we actually want without all those influences. What is it about, at a high level, what is it about these experiences that alleviate the depression that has otherwise been untreatable, unsuccessfully treated?
Well, just chemically, there is something different about ketamine. It works on glutamate, which is a neurotransmitter that most conventional antidepressants don't touch. The standard antidepressants work on serotonin or norepinephrine or dopamine. Ketamine also increases levels of BDNF, brain-derived neurotrophic factor, which is the brain's own healing, growth promoting factor. I kind of think of it as like fertilizer for the brain. So even just like on a chemical level, ketamine encourages the branching between brain cells. There's a
Mm.
great slide even showing like just 24 hours before and after a ketamine treatment, the neurons, the brain cells get thicker and healthier looking as opposed to, feeling being skinny and anemic and someone that is depressed. And so, yeah, it works on both that chemical level differently than antidepressants. Like I said, also works very quickly, oftentimes after one treatment. For some people, it's 2 to 4 treatments. But people do feel better very quickly, as opposed to conventional antidepressants may start kicking in a week or two if you're a fast responder and take 4 to 6 weeks to work. And
Yeah,
then
that's a rough period when you're in emotional pain and you start a medication, you have to wait a month until you feel better. That's
Right,
rough.
right, right. Yeah, and then there's not a guarantee that you will, or you might have side
Right.
effects. So sometimes we have to try a number of medicines. So yeah, I mean, it's not easily can take 6 months to kind of settle on a good conventional
That's
antidepressant
brutal.
regimen. So
Yeah. So, what are you hearing from the patients when they come back? I want to kind of leave people with some stories about, I mean, everyone wants to feel that relief. Everybody wants to be relieved of these things like depression and anxiety. What are some of the stories that people come back to you with?
yeah, I mean, just they're able to stop and smell the roses more, like kind of savor the little moments in life, the connections that they have with other people, instead of being locked into their default patterns where they just go through these pre-rehearsed steps of, getting up, getting ready for the day and work and, and focusing on like kind of being on that treadmill in Western capitalist society. Like they have more of like a pause and a reset where they can evaluate maybe even decisions that they didn't know that they had. They can um, choose to do things differently, take downtime, and make a meaningful effort to reach out to people more if they've realized that, their friends sustain them, but they haven't seen their friends in months. Everyone's busy, but, and it may take that extra effort, but it could be worth it. And so, creating an intention to just call 2 friends a week and get together with, a friend like at least once a week. I mean, every person's going to have kind of their own schedule and their goals around, yes, socializing. But ultimately, what we know makes people healthy and happy is connections to people, and also meaningful activities like jobs or hobbies that, mean something to them, or volunteering, things that kind of increase their connection to the world, giving back. Yeah, I mean, speaking of like 12 step, 12th step being to kind of spread the message of recovery. I think that's just good human advice to kind of spread
Right.
positivity throughout the world. The things that
Yeah.
you've found beneficial and meaningful can help other people too, and you'll get joy in seeing that process in other people take place too.
Yeah, absolutely. I always think of service as one of the fast tracks to building self-esteem because it's hard to look into the eyes of gratitude and still feel bad about yourself
Right.
if you help someone else out. Yeah, no, this is really helpful. I think people just really need to be clear on the potential outcomes, the relief from depression, the freedom to be who you really are and love and accept yourself and really start cultivating these feelings of peace and joy. It's so easy to get mired down in like this hustle culture or what we should be doing that we totally forget like what life experiences are possible once you're sort of free of this weight of depression and anxiety, things that, I mean, literally depress you so that you can't feel the joy. So I feel like this will give people a lot of hope and some clarity about who it's for, who it's not, and maybe some of the work involved too. It's not a magic bullet, as you were saying. It sounds like there's some work involved, but yeah, I think this will be super hopeful for people who've been walking around with this treatment-resistant depression, who, have formerly been addicted, who maybe have some hope that things will get better.
Yeah. Yeah. Thank you. Thanks for the opportunity.
Yeah, it's so good to see you. So I will leave links to all of the ways for people to get access to you. Is there anything else that I forgot to ask you, or any message you would like to leave people with?
Yeah, just that there is hope and there is no shame in reaching out for help. I think too often people feel hopeless or shame, and those tend to be the two weights on a person that keep them suffering in silence and alone. But, there is help, and there are trained professionals who are in that field for a reason too. It's not a field that people go into just for the sake of finding a job. I mean, people that are in the mental health field, one of the things that pulled me into it is that I found that people that were in the field were among the, kindest, most generous people that you want to be around in the first place. So people are ready and willing to help you whenever you're ready.
It's beautiful. Well, thank you so much.
Thank you. Great seeing you.